Good morning, darling. Please call me Pad. I was just contemplating life and sipping my coffee on this beautiful morning. But yes, on to the research. For this study, 30 children were chosen to participate between the ages of 4 and 6 with a primary disorder of ASD, Autism Spectrum Disorder. They were selected from early intervention programs in South Florida. The Childhood Autism Rating Scale was used to divide them into two groups of 15. One group was made of participants with severe ASD, and the other 15 were in the mild to moderate ASD group. As far as the research design goes, each child took part in a 3-week research program where they participated in 6 10-minute one-on-one activities in 2 different music conditions. Half of the activities were carried out with a simple music condition, and the other half were performed with a complex music condition. Yes, actually, the sheet music used for each condition was published directly into the article. During week 1, the severe group had simple music 3 times a week, and the mild-moderate received complex music 3 times a week. Both groups had week 2 off, and then during week 3, the groups had the alternate music condition. Both groups had the same activities each week, just with different music. Oh, certainly, darling. For the ocean drum activity, the child is directed to first sit on the mat. The drum is placed between the therapist and the child. The therapist plays the keyboard with one hand and rocks the drum with the other while singing, "Listen to the drum." After the song was performed one time, the music therapist continued playing the ocean drum with her left hand, pointed to it with her right hand, and said, "Look at the drum." The point and verbal direction gave the child an opportunity to respond to an active joint attention by following the therapist pointing to the drum. This was done a total of 5 times each session, giving the child 5 chances to bid for joint attention. Now back to you, Lauren in Manchester. Tell my partners, Kona, Brady, and my love, Bear. I say hello, mates, and look forward to sharing a bottle of scotch with you.
Hi Lauren, happy to be here. I wanted to talk a little bit about the outcome measures in this study. The early social communication scales were used to evaluate the children's response to joint attention, RJA, in the study. The ESCS, as it is commonly called, measures nonverbal social communication skills in children with the mental age of 8 to 30 months. This particular outcome measure was adopted in order to address the musical aspects of this study. The information from the ESCS was used to create 6 structured musical experiences which were designed to elicit the responses to bids for joint attention. The original ESCS was used as a guideline to create the datasheet for this study, and a specific description of RJA was outlined to ensure accurate coding. In short, yes. The researchers found a statistically significant interaction between music modality and level of functioning. First, the level of functioning within each modality was assessed. In the simple music condition, neither group showed a significant difference in their RJA score. However, in the complex music condition, children in the mild-moderate group had much higher scores than their severe group. Then the effect of music modality within each functioning level was examined. The simple music condition was found to be more effective in eliciting joint response in children with severe ASD, which was shown by the statistically significant difference in RJA scores between the two types of music. The complex music was more effective in eliciting joint response in children within mild-moderate ASD. Well, the researchers in this study included a brief review of the literature that cited other studies that showed that music has been found to be instrumental, no pun intended, in organizing sensory input and focusing attention. And as to why there was a difference between groups, it could be because the children with severe ASD were overstimulated by the complex music. The researchers described that some of these children cover their ears with their hands in this condition. Nothing was written in the study that mentioned any activity was cut short, no.
We all know, Lauren, I only do it for the complimentary package of tennis balls and dirty socks you all ship out to me after every show. And the ladies. Let's not forget the ladies. Now, Lauren, this is an interesting study, but there are a few limitations to it that I would like to address. One of the biggest limitations of the study was that it did not have a large sample size. With a sample of only 15 children, it makes it difficult to generalize the results to a larger population. Another limitation in regards to the sample population was the narrow age range of the children in the study. Having children in the study only ages 4 to 6 decreases the ability for the outcomes to be generalized to a broader age range. Finally, the study did not have a control group with no music. Therefore, it was not a randomized controlled trial. We all know that a randomized controlled trial would have been the highest level of evidence for this sort of study when looking at the effectiveness of an intervention. If the authors were to repeat this study, it would be useful for them to have a larger sample size with a broader age range in order to be able to better generalize the results to those with autism spectrum disorder. It would also be helpful to have a control group in order to increase the validity of the study and better determine the effectiveness of the intervention. If the authors were to repeat this study, it would be useful for them to have a larger sample size with a broader age range in order to be able to better generalize the results to those with autism spectrum disorder. It would also be helpful to have a control group in order to increase the validity of the study and better determine the effectiveness of the intervention. The authors of this study had some suggestions of their own for future studies as well. They suggest studying the children's ability to shift attention before actually bidding for the joint attention. Shifting attention is also a task that those with ASD have difficulty with, and the authors believe it may actually be a prerequisite task to the joint attention. In regards to using this musical technique for engaging a child in joint attention in terms of physical therapy, it would be beneficial to perform a study using music during a physical therapy session. The music could be used to gain the joint attention of a child in order to allow them the focus to perform a certain exercise, such as a towel stretch for stretching the heel cords. That's all I really got out of the article, Lauren, because I had to get back to playing with my dad's flip-flops, but I hope this has been helpful for you. Thanks again for having me.
As physical therapists, we will work with people from all walks of life. Whether we choose to specialize in a field of children with ASD or outpatient, it is equally important that we have the knowledge not only of ASD, but of ways we can formulate effective treatment plans. Well, we learned just how important of a tool music can be for children with varying degrees of ASD. When we come across a patient with ASD, it would be very beneficial for us to incorporate music in our treatment plan. Well, first off, music can be a great way to help the child become more at ease in his or her environment, which can allow for an easier treatment session. But in particular, this article emphasizes the positive influence music has on joint attention for a child with ASD. Increasing our patient's ability to maintain joint attention will allow us to truly engage those we work with. This can allow us to more effectively encourage our patients to properly perform exercises and accomplish motor learning. First, I would recommend a treatment room for the session in order to eliminate in-clinic distractions. Coupling music with certain exercises will make the exercises much more effective. For example, using music to gain joint attention and then having the child reach for the object multiple times in different places while standing would be a great dynamic balance exercise. Additionally, the most effective music used in treatment sessions could be recorded for the patient to take home in order to facilitate an effective home exercise program. The behavioral outcomes evidenced in this study, as well as the fact that many cortical connections are necessary for joint attention, indicate that music facilitates joint attention. While neuroplasticity cannot be measured directly, the progress that participants in this study showed over time in more frequent joint attention could be evidence of neuroplastic changes facilitated by the music condition and induced by meaningful task repetition. Even if these improvements are not, in fact, the result of permanent neuroplastic changes in the brain, the research presented in this article can have a huge impact on achieving neuroplastic changes in our patients with ASD. Since Nudo hypothesizes that neuroplastic changes are established through meaningful repetition, it is clear that improving a patient's ability to maintain joint attention can help them perform a high enough repetition of tasks to achieve neuroplastic changes in nearly any desired activity.